given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
See, I don't need no reason. You provide the healing. There was some hard times. We were living some dark lives.
Listening to
We did not know where we were.
Radio Al Ansar, Kidamaritz, 105.6 FM.
You took the time out to teach us so that the guidance would reach us, and you know we're ready. Muhammad ya Rasulullah, Muhammad ya Rasulullah, عليك وسلم المولى محمد عليك وسلم المولى محمد. Look up to the best of the men, and I'm working on the test of the end. Boss following the message he sent, and try turning these lessons into action. Oh, I pray for the day that I see my dreams. For all humanity, you gave me the blueprint of life, taught me the rules and the right, shining like the moon in the night. This is how we speak.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم Assalamu alaikum wa rahmatullahi wa barakatuh. It's Saturday, the 21st of June and the 5th of Muharram, 1448 AH. And you're connected to Radio Al Ansar, Durban 90.4 and Peter Marisburg 105.6 FM. And if you're around the world, tap into www.alansar.org.za. If you've just tuned in to the Pulse Show, I'm your host, Shubnum Ismail, and we have a power pack session just for you. Today we are talking about something that affects so many of us, arthritis and vitamins. And you hear taking your vitamins all the time, but how much do vitamins really help stiff joints and aching bones? So joining me today is Dr. Sthembiso Mntambo. Welcome to the show, Doc. It's great to have you with us.
Thank you for having me, Shubnum.
So listeners, Dr. Mntambo is here to break down what actually works, what's hype, and how small daily choices can make a big difference. So stay tuned. So let's just get to know our guest a little better. Dr. Mntambo is 32 and was born in Greytown, KZN. He grew up between Durban, Escott, and Greytown before spending almost 7 years serving in the government health sector. He's now the founder of MOT Health Center, a new GP practice operating at 87 Allen Payton Avenue here in Pietermaritzburg. With a strong passion for orthopedic surgery and pain management, Dr. Mntambo believes treatment should never be one size fits all. Everybody is different, so every treatment plan should be good. His goal is simple: to create a space where patients get comprehensive, holistic care at fair and at affordable rate. So let's dive straight in. Doctor, can you tell our listeners what's the difference between getting vitamins from food versus taking supplements?
Okay. So before I answer that question, just a bit overview about the vitamins. Currently, in the times that we're living in, there is a lot of use of vitamins for cosmetic purposes and for other purposes. So pharmaceutical companies are advertising a lot of vitamin use, as people are predisposing themselves to vitamins a lot. So it's not bad practice using too much vitamins, but if you are taking something that you don't really need, that could be a waste of your money and it could be a redundant move. So looking at difference between the vitamins that we get from the food and vitamins that we get as supplements. So the food that we eat, depending on how your diet is balanced, so you will get the vitamins that you need and all the minerals that you need that are provided by the food, especially if you don't have any malabsorption in your stomach and you have no other requirements for those vitamins. So the food will be adequate. But then if you do need supplementation, your body will tell you that you need supplementation. You have some symptoms, and then that's in that that is the time where you will need to take supplements. Then the supplements then come in the form of pills, gummies, and everything. those ones you will have to then talk to your doctor first, find out how much of the supplement that you're supposed to take, then just taking the supplement on your own. I think I answered the question. Yeah.
Yeah. So, Doc, can taking too many vitamins be harmful, and which ones are risky in high doses?
Yeah, taking too much vitamins can be harmful, and taking other minerals, because not just talking about the vitamins, just all the other minerals that are taken as supplements, it can be harmful, because if you take too much of one thing or too much of a certain substance, it can actually reach a toxic level in your blood, and that toxic level can affect your liver, which is responsible for storing most of the substances and distributing it to the body. It can affect things like your kidneys as well, which are responsible for excreting those vitamins. Taking things like too much magnesium can affect your muscle, how your muscles are functioning. Too much potassium can affect your heart as well. And vitamins, not really, the vitamins, they don't really cause too much problems, but it's a waste of money taking too much of the vitamins, because they will just be excreted out of your body without doing anything that is important.
So, Doc, how do we know if we are lacking certain vitamins? Are blood tests always necessary?
You will know by you will get certain symptoms, and certain symptoms go with certain deficiency of the vitamin, or let me say mineral. So you have symptoms like muscle weakness, you get body cramps, you have bone pain, feeling tired, poor wound healing, being pale. Those are all the symptoms that you might get. And you will not know which vitamin that you're lacking unless you do a blood test. And that blood test will then tell you which one you need to supplement, because some of these symptoms, they actually overlap each other. So you might find that you have a vitamin B12 deficiency, and you think maybe it's just anemia, which is the lack of red blood cells, but it could be something else. It's instead of just anemia. So blood tests are always warranted for checking which vitamins that you need to actually supplement.
And what's mega dosing, and why do people do it? Is it safe?
Mega dosing, it's people taking too much of vitamins than they actually require to take. So that practice, I would say it's not safe, because looking at what we are talking about, taking too much of the vitamin, you will reach a toxic level. And once you reach a toxic level, you affect the other organs in in your body, and affecting those organs might come with permanent damage in the future, and no one wants that. So mega dosing is not safe.
And are gummies, capsules, or liquid vitamins better absorbed in our systems?
So with gummies and liquids, because the way you take them, so for gummies, usually they come in flavors, so it's better, it's easy to take those. And once they reach the stomach, they reach the stomach in in a liquid form. So if it reaches the stomach in a liquid form, it's easily absorbed by your gut. And then if you're taking a capsule might take longer to be absorbed, but it will be absorbed at the end, as long as you do not have anything that is preventing the absorption of those vitamins.
So I know that, quite a few of us, buy vitamins when they're on special and those sort of things and stock up on them. Do they relatively expire, and does storage affect how well they work?
Yeah. So looking at all the substances, all the medications, even if we're not talking about the vitamins, all the other medications that we take, even the foods, everything. So everything has an expiry date. So once it reaches that date of expiration, the effects of it working in your body will be affected. So the potency may decrease. I may not be sure how long it will take for it to start not working, because sometimes the expiry date might say, let's say today, the 20th of June. Maybe you can still take it up to the 20th of July, but going above that month, yeah, they will lose the potency, they will lose the effectiveness.
And can vitamins interact with prescription meds like blood thinners or maybe thyroid drugs?
Yes, they do. Not just vitamins, as well as I've been mentioning. So, drugs. There is drug to drug interaction with most of the drugs that we take. So, that's why I always urge people to talk to the doctors first. talk to your pharmacist as you are buying the vitamin. Let them know which medication you are supposed to take this medication and how will it affect you. Because sometimes, let's say you're taking something that interacts with your diabetic medication. You see that you take metformin. Let's say you take metformin twice a day, and you're taking something that will interact with the potency of metformin in your blood, meaning it will either increase it or decrease it. So if it decreasing it, that means the metformin that you're taking is not enough now for your blood. You might need to take more. So that's why it's always important to get the advice from a medical professional first.
So it's vital that listeners, you don't just go buy anything out of the counter without checking in with your physician and your GP so that you are following protocol guidelines and not causing harm to yourself. So, Doc, let's talk about bone and joint and immune health. Which vitamins and or minerals are most important for bone and joint health?
So for bone and joint health, the main vitamin that is important, it's the calcium, because calcium is the building block of the bones. So it's responsible for the integrity of the bones. And we have vitamin D as well. Vitamin D is important in a way that it helps the calcium to be better absorbed in the body. So without enough vitamin D in your body, I mean, you cannot absorb calcium well. Another thing would be vitamin C as well. Vitamin C works in the synthesis, making up the collagen, which then makes up the cartilage, which is in your bone, in the bone space, in the joints. Yeah, so vitamin C is important for the cartilage, vitamin D for the absorption of calcium, and calcium for the integrity of the bone. There are other ones, but those are the main ones that are important for the bone joint.
So when it comes to vitamin D, Doc, if you do not get enough sun with taking the medication help, and does vitamin D also assist in prevention of hair loss?
Okay, so if you do not get enough sun, because sun is the predominant giver, yeah, of vitamin D. So if you don't get enough sun, you might need to take the vitamin D supplement so that it can assist you with the absorption of the calcium, as I was explaining before. So the requirements, they vary with age, the requirements of vitamin D in the body. So with kids below 1 year, it's about 400 international units, which will then translate to around about 10 to 15 micrograms of vitamin D that you require daily. And with ages 1 to about 69, you need about 600 micrograms. Oh, sorry, 600 international units. And then above 70, you then need 800 international units. So if you are not getting enough of that, then your bones will be affected. Then with regards to hair loss, I have not done a study regarding hair loss as well, and vitamin D. So me giving you advice on that would be shady.
And Doc, is calcium enough for bones, or do we need magnesium?
So calcium alone will not be enough for bones. So you do need things like magnesium and vitamin K2 for the formation of bones. So we need these minerals because they assist in the transport of the calcium directly to the bones. No, they take it from the bloodstream and send it to the bone straight, because you need calcium in the bones, not in your bloodstream. Because when you have calcium, too much calcium in your bloodstream, it can cause other problems. So calcium needs to be redirected to the bone. So vitamin K2 and magnesium, they do assist in that transport. Yes.
And can omega-3 supplements reduce inflammation in the body?
Yes. So omega-3, how they work, yes, though they are supplements, because we don't produce our own omega-3s. So we usually get them from foods like fish. So they are fatty acids that we take as supplements. They do help with the inflammation of the body in a way that they they suppress the production of cytokines, which are inflammatory markers. And then reducing that production will then reduce the inflammatory response in the body. that is in your heart, in your gut, and in your bones. So using the omega-3s can have an advantage in you.
At the end of the day, it is, we are what we eat. So it's about having
Yes.
the balanced meals, having enough protein, and ensuring that we actually are nourished.
Yes, yes. So even speaking with your dietitian can actually help you because they know which nutrients, which vitamins are in which food.
And what about vitamin B12 and B6 and folate? Do they affect nerve pain or fatigue?
Yes, they do. So vitamin B6, 12, and B9, they help with nerve repair. They help with blood production. So with things like that, if you have less vitamin B12 in your blood, or let me say in your system, so will then predispose you to having some nerve damages. Or if you have some nerve damages, it's having the deficiency will actually prolong the healing of the nerve. So taking the that's trio, which sometimes it comes in a form of a pill that is called a Neurobion. I'm not advertising for the company, but they do help with the fatigue. They do help with the nerve pain. They do help with the nerve repair as well. But there is this thing that has been happening in mostly in public, where we use vitamin B6, which is paradoxin, to treat the nerve damage. So for people who come with peripheral neuropathy, we give them vitamin B6, which is not the right one to be given, because vitamin B6 is actually used in TB patients because they are on isoniazid, which is a TB drug. And that drug causes the peripheral neuropathy by causing nerve damage. So B6, what it does is it takes away the free isoniazid that has not been used by the body and helps it to be excreted out of the body. So treating someone who had, let me say, someone who has diabetes and they're presenting now with a neuropathy, giving them vitamin B6 just alone will not help. They need to be treated with the vitamin B12, and then you can add the B6 and B9 as well.
So you can add a cocktail so that it actually adds value to the system.
Yes.
I hear you. So, Doc, are joint health combo pills like Astro E is worth it, or better to take nutrients separately?
So for the combo pills, I would say they are worth it because most of them they come as it says is a combo pill. So they will have the supplements that you need, and some of them they add either an anti-inflammatory inside, or they will add some pain medication. So instead of taking one thing at the time, you just get one thing as a whole at once. So I would say combo pills they do help.
So, Doctor, just to add value to our listeners so that they understand the difference, can you tell them what is the difference between osteoarthritis, rheumatoid arthritis, and other types of joint pain?
Okay, so let's start with joint pain first. So joint pain will be pain in your joint that can be either due to an injury, a sprain, or it can spontaneously happen sometimes. Even when you have flu, you do get joint pains. But with joint pain, it usually resolves, or it gets healed right after taking some pain medication. And then if you do an X-ray, you find that there are no changes in your bones. There is no arthritic changes. So that's just bone pain, and it will heal after a few days. But then with arthritis and rheumatoid arthritis, um, they will then last for a longer time. Then osteoarthritis usually affects the weight-bearing joints, which is from your lower back going down to your ankles. So that's one because of the wear and tear. Yeah, you get the joint being affected due to bearing too much weight.
Do you see that mostly in older patients?
Yes, so it's all the patient with a high BMI as well. So because of wear and tear, yeah, you get the osteoarthritis. And then rheumatoid arthritis is an autoimmune disease. So that one can happen even in young people, juveniles. So that's one, it will be the body's autoimmune response. So it's the body affecting itself. So the body attacks the joints and then cause the inflammation in the joints. So that one needs to be properly investigated because the effects of it can actually go to other organs as well. and you need to be treated by a specialist for rheumatoid arthritis. So for just arthritis, you do an X-ray, you see that it's only just one joint that is affected. You can give pain medication, you do your physios and everything, you should be fine.
But arthritis can be a long term problem. It's not just diagnosed as once off. It can be treated, but it can be long term.
Yes, it can be long term, and most of the time it's actually long term because according to my knowledge, arthritis is not reversible. Once the insult happens in joint, then there is no way of reversing it except for replacing the actual joint. So you need a joint replacement for you to heal.
Listeners, we are going to take a short break. Stay with us with Dr. Mntambo, and we are talking vitamins and arthritis. Which ones actually help your joints and which ones are just hype? Don't go anywhere.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
For over 5 decades, Sunfoil has nurtured a legacy rooted from our land. From a sunflower seed grown with goodness and love, crafted through excellence, precision, and care. Proudly South African and the only 100% pure sunflower oil endorsed as a diamond partner by the Heart and Stroke Foundation. Cook with confidence, serving the best to the people you love, from one dish to the next. Sunfoil, the heart of good cooking.
Feed your soul with knowledge. At the Al-Ansar shop, you will find a wide selection of Qurans, Islamic books, children's literature, educational resources, gifts, and inspirational reading material. Whether you're beginning your journey of learning or expanding your Islamic library, we have something for every age. Visit the Al-Ansar shop today. Al-Ansar shop, inspiring hearts through knowledge.
Your station, my station, our station, Radio Al-Ansar.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
ما يقال عندي بسم الله بك نبدا حبك في سلطان جسدي مع السكي يا عين واحدة اللي تسعدني تبني شهداء فوق شهداء يا محمد يا سيدي يا محمد يا سيدي صلى الله اللهم صل وسلم طول الدهر على نبينا نجوم الليل إلينا واستخلاف الحوت الأبكار البحور الغامضين محمد يا سيدي صلى الله عليك نبدا ما يوم عندي بسم الله وبيك نبدأ حبك في سلطان جسدي معزك يا عين محمد يا سيدي صلى الله عليك يا سيدي صلى الله عليك يا محمد
And we back, listeners. Assalamu alaikum wa rahmatullahi wa barakatuh. You are connected to Radio Al Ansar 19.4 and Peter Marisburg 105.6 FM. You're connected to the Pulse Show with myself, Shubnum Ismail. If you are just joining, we are talking vitamins and arthritis today with Dr. Mntambo, founder of the MOT Health Center in Peter Marisburg. Doc, before the break, we were setting the scene, so let's dive straight into it. Can you tell our listeners what actually causes chronic pain?
Okay. Sorry. Regarding pain, so before I say chronic pain, so a pain is just a most underrated condition that is affecting our community, because pain is subjective, and there is no way of knowing what the other person is feeling unless you've actually felt that thing before. And even with that, our way of perceiving the pain, how we feel the pain, is not the same. Some people have a higher pain tolerance than others, and some people have a lower pain tolerance. So my 5, if we're grading pain from 0 to 5, my 5 cannot be the same as your 5. Yeah. So with chronic pain, you get that. So usually pain, we expect it to last for a few days to up to a few weeks, because of it's due to an injury. It's due to maybe you had an operation or something like that. But then when it goes over that and it goes over months, now you have to be taking pain medication every time, every day. Yeah, that's when we start saying you have chronic pain. So it can be due to various things. Sometimes can be illnesses. Sometimes it can be structural thing that is happening, like arthritis. So when a person has chronic pain, when they have chronic pain, what did I want to say? Sorry. So yeah, okay. Headaches as well can come as chronic pain, because there are people who suffer from migraines, which are a very long term headache. So with that, you actually need to understand that that person is going through something, and they will need support from, whether if they are working, they will need support from their employees, from their employers. Sorry, from their employers, to better manage the pain, because chronic pain can push a person to depression, and it does. And not just it does. It do push people to depression. Talking from experience, I've seen a few. Yeah. So with that, chronic pain should not be as underrated as it is. And I recently just found out that in South Africa, we actually do not have pain specialists. We only have a few, let me say 2 doctors who are pain specialists, who have actually went and learned thorough about pain and chronic pain. And so the treatment that we're giving is just the pain, the analgesia. As a person is coming to me and is saying, I have a joint pain, I just give you some diclofenac and send you home, without really diving deep into it and finding the actual cause and what really happened to you, and how long has it been, and how is it affecting your life. So chronic pain is something that is serious and should be taken really serious.
I see you're quite young in your career, Doc, so maybe you'll want to expand your credentials and look into more pain management resources and maybe offer that to the community here in Peter Marisburg.
Yeah, if I'm given the opportunity, I will.
So we are in winter, Any advice for our arthritis patients? You hear about weed bags and, heating the water bottles and those sort of things.
So winter is like the worst time for people who are suffering from joint pain and let me say bone pain or anything related to joints and bones, because and just the cold alone. If let's say you have a fracture or you just bumped your shin walking in the room, if there is cold, you can feel the cold that it's sipping in your bone. That's how much painful it is. So in winter, where it's really cold in the morning, you get your muscles cramping up in the morning. So if your joints are already affected and your muscles cramping up, that muscle will cause the bone pain to be severe. So there will be stiffness in the morning, there will be severe pain in the morning. So using things like heat packs, water bottles, especially as long as you're not using an old water bottle that's gonna burst and burn you. So using those things can actually help to soothe the pain. Taking cold baths, not cold, warm baths, soaking in the water can actually help relax the muscles and relax the joints.
And can diet and lifestyle make arthritis pain better or worse?
Diet and lifestyle, so they can actually assist in making the arthritis better in a way that so if you're eating things that has more calcium, more vitamins that are responsible for the bone and joint health, then so if you're taking those things, they will assist you with managing your pain. But that is if you are in the early stages of arthritis. Because now, if you are in the later stages where it's a severe form of arthritis, it will not help. Taking supplements will not help in that case. And then with weight, weight will actually help you because if you have a higher BMI, you run a higher risk of developing arthritis or accelerating it to a severe arthritis, even if it's in the early stage. But if you reduce weight while let's say you find that okay, you're starting to have some joint pains, especially in your lower limbs, and you reduce your weight, you stick to taking supplements and everything, then you have a better chance of having your pain managed.
So is no pain, no gain true for exercise with arthritis?
So that goes to the severity of the arthritis as well. Because if it's still early, it will help. You might feel the pain when you're trying to do the exercises, but as time goes, you will be fine because your muscles will be stronger, so there will be better support for your joints. But in the late stage, moving that joint that has no synovial fluid, which is the fluid that is supposed to be inside the joint, and that has no cartilage, then that will cause more pain and you will not be gaining anything from that.
So, Doc, does vitamin D deficiency really make joint pain worse?
Vitamin D deficiency, making it worse, I have not done a research on that, but I would say yes, because with vitamin D, since it helps with the absorption of the calcium, if you do not have it, then your calcium will not be better absorbed. So lacking calcium will then make your bones to be brittle, to be more susceptible to the disease, or let me say to arthritis. So the pain may be more severe than in someone who has vitamin D.
And are there vitamins that act as natural anti-inflammatories?
Vitamins as natural inflammatories, yes, they are. Okay, I may not mention them, but they are vitamins that work as natural anti-inflammatories. Let me see. Okay, thing is, I've forgotten the actual vitamins, but
Yes.
yeah, there are. You can just go to Google, because people use Google for other things than researching things that are really important. So you can search on Google and search which vitamins actually assist in the inflammation and in bone healing, in body healing as well, and then you will know that you are taking the correct vitamin.
Doc, I know you mentioned earlier that fish oil is very important. Can you just elaborate about that?
So fish oil, which is the omegas, yes, the omegas, we don't produce it on our own. We need to take it as a dietary supplement. So the fish oil, I did mention a bit that they suppress the production of cytokines, which are the inflammatory markers, causing the inflammation in the body. So that inflammation can affect your heart, causing heart disease. It can affect your gut, causing inflammatory bowel disease, and it can affect your bones as well. So if you are taking those supplements, you are eating the fish, getting the nutrient that you need sufficiently, then your body has a better chance of reducing the inflammation and combating the pains.
There's a question from a listener. I'm currently experiencing cramps. What supplements can be taken, or do you have any advice for me?
So if you are currently experiencing cramps, most of the time the cramps can be better if you are taking things like magnesium. But I can't just say just use magnesium only and you'll be fine. So with you having cramps, you do need to be properly investigated as well. Just see someone. See someone. It doesn't need to be a doctor. You can see a nurse as well. You can talk to your pharmacist as well. They have a better understanding. They do know what they're doing. So they will tell you. Using magnesium, using this supplement can actually help you better.
Listeners, let's take a quick pause. We are still with Dr. Mntambo talking about vitamins and arthritis. And if your joints are stiff this morning, you're not alone. So stay with us. We'll be back in a flash.
Gentlemen, it's back. The legendary Opanankan anti-stress shoe has returned to Brasilia and designer shoe outlet. Handcrafted in Brazil from ultra soft premium leather, anti-stress comfort, diabetic friendly. Built for real, everyday wear. Tried, tested, and trusted by men, from the workday to weekends. Back in limited quantities. Available at Brasilia Pavilion, Midlands Mall, Westtown Square, and designer shoe outlet Westwood and South Coast Mall. Opanankan Anti-Stress. The peak of comfort technology is here.
Radio Al-Ansar welcomes your feedback. If you have a broadcasting related complaint, please put it in writing and address it to the head of the complaints committee. Include your full name, contact details, a clear description of your complaint, and any supporting documents. You can email your complaint to feedback@alansar.org.za. That's feedback@alansar.org.za. Or bring it in person to our Pietermaritzburg office at 240 Ortman Road, Willowton. Your input helps us serve you better.
اللهم انصر إخواننا المستضعفين على أرض فلسطين. اللهم انصر إخواننا المستضعفين على أرض فلسطين. اللهم حرر المسجد الأقصى من اليهود الغاصبين. اللهم انصر إخواننا المرابطين على أرض فلسطين. اللهم شد أزرهم وسدد رميهم برحمتك يا أرحم الراحمين. اللهم الطف بإخواننا في كل مكان يذكر فيه اسمك يا أرحم الراحمين. استنصروك يا الله فانصرهم. اللهم ارحم الضعفاء والفقراء والمساكين والأيتام والنازحين والمشردين والأسرى يا أرحم الراحمين.
اللهم أنج المستضعفين من المسلمين في فلسطين. اللهم كن لهم عونا ونصيرا. اللهم كن لإخواننا المرابطين في المسجد الأقصى. اللهم كن لهم ولا تكن عليهم. اللهم فرج همهم، نفس كربهم، داوي جرحاهم، عاف مبتلاهم، اشف مرضاهم، ارحم موتاهم، تقبل شهداءهم.
Radio Al-Ansar, 24/7. 365.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
He makes the birds fly. He made the blue sky. He makes the sunrise. That's Allah. He makes the clouds cry. He calms the seas tide. He makes the wind dry. That's Allah. Which of the favors of your Lord can you deny? Read His words. He's the creator, the master, the majesty of the universe. La ilaha illallah, 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 la ilaha when life's a hard fight, and when we lose sight, He'll make it alright. That's love. We can never lose hope.
Assalamu alaikum wa rahmatullahi wa barakatuh, and you're listening to Shubnum Ismail on the Pietermaritzburg Pulse Show on Radio Al Ansar 90.4 and Pietermaritzburg 105.6 FM. And we are in conversation with Dr. Mntambo from MOT Health Center. He's a general practitioner here in the city of choice. I'm in conversation about vitamins and arthritis. Doc, it's great to have you with us. So let's dive straight in. Are there any new therapies, injections, or approaches that you're excited about regarding pain management, vitamins, and arthritis?
Yes. So currently, it's something that is being done almost by every other GP, but we do give things like vitamin IVs. IV vitamins, which is vitamin B. We do give vitamin C as well. IV as an infusion. They help with though they help with the skin most of the time because people are using them for cosmetic purposes, but they do help with the pain management as well, bone health as well. And there are other injections that are being used by some of the GPs. Mostly they are used by specialists, which are injected mostly straight to the joints. For people like arthritis, there are things that I do offer in my practice as well. Because as I said, that I was talking from experience if I'm talking about the chronic pain. So I understand it better. Yeah, I've been through that part.
So, Doc, we hear painkillers damage your kidneys all the time. So what's the real truth in long-term pain management? How can someone prevent risks and outweigh the relief?
Okay, so in that way, you can... Okay, they do have an effect after a long-term use. And some of them not even after a long-term use, things like anti-inflammatory, non-steroidal anti-inflammatories, things like Brufen, they do have an effect in your body. So if you are taking too much of it without getting checked frequently by your doctor, by your nurse, then you are running a risk of having some permanent damage left in you. So my advice would be, if you are on chronic pain medication, at least every 3 months, do see a doctor. Let them check you. Let them tell you that, okay, you're still good to continue with this medication, or now you have to switch to another medication, because you don't want to damage your kidneys. And once you have some kidney damage, it's really hard to reverse it. So it's either you get a new kidney, which is very tedious job to actually go through, or you go through with your kidney that is damaged.
And we had a urologist on the show not so long ago, and he spoke about hydration being key. So as much as you need to take your vitamins and you need to eat right, you need to get the right liquids in and amounts as well.
Yes, you do.
So can stress, poor sleep, or low mood make arthritis pain feel worse?
Yes. So stress, low mood, or any other frustrations that you have can make any pain feel worse. They will exacerbate any pain symptoms that you have. So if you have arthritis, your arthritis will be worse. If you are going through something, if you are stressed, if your mood is not in a better space, so it will affect your pain and how you perceive the pain.
And many people stop exercising once arthritis pain kicks in. So, what's the safest way to move without making the joint damage worse? Any recommendations from your side in terms of what patients should avoid?
um okay, so with that one, I would say patient needs to be seen by physiotherapists and occupational therapists straight, because they have a better understanding on how to exercise with the pains, what to be avoided, which movements that you're supposed to do, up to which extent. So the non-drug treatment will be offered by people like physiotherapists and occupational therapists. Yes, I can advise you to rest, especially if you having severe pain, not to put in too much weight on your joints, because putting too much weight on the joint that is already affected will cause the pain. So what you need to do is to do the movement without the weight bearing. So lying down and moving your joints while you are not putting too much weight on it. Those things do help.
So, Doc, I was reading online last night that Mayo Clinic overseas in the USA is one of the frontline facilities for medical advancements. And they currently use silicone injections to replace cartilage. What's your opinion on this? And is there something modern coming to South Africa?
So regarding that, I've actually seen a few things on socials, and I've seen a few things when I've been reading on the internet as well. So there are injections that are being used overseas to replenish the cartilage. So I have not seen any evidence that I can stand on and say they will help you. And I have not heard anything about it coming to our country. It's coming to our guidelines. So I can't give an advice on that, but we are hoping that it's something that will come to us, and when it comes, because it will help a lot of our community.
So, Doc, with your experience and your passion for orthopedics as well, how can patients deal with long term pain, maybe post surgery, and have had a traumatic experience? And pain management is something that they'll obviously have to have lifelong.
So the first thing that you need to have is a better understanding of what is happening to you. As long as you have a better understanding of your condition, then you will better manage it. Then you ask your doctor, with the medication that they're giving you, how is it supposed to help you? How are you supposed to take that medication? Will it not affect other medications that you're taking, or will it not cause any other harm in your body? Because if you're taking, let me say, you take Panado, and Panado is giving you maybe nausea. It usually doesn't. But if Panado gives you nausea, then you might stop taking the Panado, where else it was going to help you with the bone. But if you ask your doctor and you tell the doctor that Panado usually gives me nausea, and then your doctor can then prescribe something else for you to take for pain. And adhering to the recommendations that the physios and the occupational therapists give you, that will help you to better manage your pain as well. Yeah.
It's all about teamwork and the multidisciplinary coming together to help each other and to actually give our patients a better outcome. Listeners, that's all we have time for today. Thank you, Dr. Mntambo, for breaking down vitamins and advice about arthritis for our listeners. How can our listeners get in touch with you? And do you have any final words regarding your practice and what you do there?
Okay, so in my practice currently, as I said, that I like treating people with pain that much. So currently, I am offering an injection that is working very well for arthritic patients. I have a few testimonies that will tell you. Someone who had a very severe arthritis, now they're walking after that injection. So that's something that I am offering. Other drips as well are being offered. I do have a lot of pain medication because I understand pain. I think I understand it better than other doctors. Not that I've studied more, but because I've experienced it. And then how to get in touch with me, you can find me on Instagram. It's MOT Health Center, and I am on TikTok as well. It's Dr. Mzamo, which is my first name. It's just Dr. Mzamo. You will find me on TikTok. And my personal number is 06622289763. You can call me anytime, but just don't call me after hours. And then I do have a number for work, just that I didn't bring my card here. Then I would give you that number. And an email address will be mothealthcenter@gmail.com. You can send out an email and you will get in touch with you. And then if you want to come through, we are at 87 Allen Patton Avenue, which is right up from Scottville Mall. You go up the road, and on the next robots by Cornerstone Church. We are opposite that church. It's the Kwanalu Agricultural Union Complex. You will find us there.
Thank you so much, Dr. Mntambo. Remember, listeners, treatment isn't a one-size-fits-all, and your joints will thank you for the small daily habits. Thank you for tuning in today's episode of The Pulse Show. Healthy joints, stronger life. Take care of your body today. To the entire Al Ansar team, thank you for your amazing work, and take care. Enjoy your weekend. From myself, Shubnum Ismail, Assalamu alaikum wa rahmatullahi wa barakatuhu.
You with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctor